Hey guys, it's Dr. David Stoker, board certified plastic surgeon in Los Angeles with a long-term beautiful result on an upper lip lift as well as laser resurfacing that I would love to share with you. Let's check it out. We have here a gorgeous woman, approximately 53 years old. I've known for a few years now. It's got a big smile, and it's an even better smile than when I met you. You can see a little bit of your teeth now down here. And the reason that we can do that is we did two different procedures to her lip about 3 months ago. We did an upper lip lift where I removed a significant amount of skin from underneath here with an incision disguised in the shadows underneath her nose. And honestly, I cannot see any scar at all, even under magnification. You must have looked at it under magnification too, right? In your makeup mirror?
Of course.
You can't see it, can you?
No, I can't.
That's what I call a win.
No.
It's a little scary operating on somebody when they're really pretty to begin with, or really handsome, because I've got a lot to lose and not that much to gain, but usually it works out nicely, and it worked out really nicely for you. You had a second thing here, which was a mucus seal down here, maybe from biting your lip or just, I don't know what happened.
At night, it could be.
But it didn't look good. It looked like a small tumor kind of plunging there, like you had something in your teeth, and it was not, I know it was kind of embarrassing to you.
It bothered me a lot when I smiled, yes.
And so we got rid of that also, and again, I can't see that incision also. That's hidden at the border of the wet-dry vermilion there. So that's relatively easy for me to do, but it's that upper lip lift, getting a very nice proportion. Because we remove skin on the outside, but not mucosa on the back side, it has a tendency to lift this up a little bit. It simulates younger, plumper lips. Also really happy with her eyes. We did fractional carbon dioxide laser resurfacing around this area here in order to help tighten that area. The way it does that is by, in a controlled way, wounding that skin. When the body heals it, it spreads out those fibroblasts across the skin, tightens up everything overall. But when the little lines follow, start to surround them, it starts to steal away the beauty a little bit. Let's talk about another subject now, about this lower face and neck lift that we did on you a couple of years ago. It's very complementary to everything we did. Your neck here, if you just lift up a little bit, you can see she has gorgeous, nice tight skin there, very little laxity. Let's turn you to the side. This is a really great example of the Traceless facelift. I mean, probably the last thing you would want is for everybody to know, looking at you, that you had plastic surgery. This combination of procedures that we performed on you with the face and neck lift, eyelid surgery, upper and lower, multiple rounds of that, upper lip lift, sounds like a lot, but we spread it out over a few years, and look at what we got for that.
That was, I think, the best part for me, because I like to do things in little increments, and that's exactly what we did, and nobody really knows other than the people that I told. I'm someone that does her homework pretty much with everything in my life. So I was considering other surgeons, and at the time I brought my husband here to meet with Dr. Stoker, and when we did the consult, I did not know so much about his education until we actually met with him. And my husband, when we left here, who's he's pretty good at reading people and making decisive decisions, and he says, why would you want to go to anybody else but him? But I needed to just have a day or two to kind of think, and I actually prayed on it, and it was something that was a pretty easy decision. I had a lot of peace once I met with him. He very much took his time with us, and he comes across with confidence, but with a lot of humility as well, and I just felt very comfortable with him.